So I know the introduction will be done officially tomorrow, but I don't mind if the board members available, Chairman Charles Kedinji, Richard Mutoka, Bernard Kimayo, Professor Amugune Beatrice. I'm sure those of you who went through the University of Nairobi, she taught you. And then Isha, you will meet her in Nairobi Hospital. She also trains mostly interns in that institution. So those of you who went through Nairobi Hospital must have gone through her hands. So having done that, then let me come to what I intend to present. So it is about a dynamic health environment. From the role of the pharmacist, initially where you used to be looked at a dispenser, to what is available today, things have changed. Can you show the first slide on introduction? Yeah, so in the outline of what I intended to present, which I will leave you to read, those are the areas I will touch on. And my chair will be speaking tomorrow. I don't know if it will be a repeat. I'm sorry, Chair, if I'm stealing the thunder from you, because we were never given areas to be specific to. I thought they would tell me to look at the regulatory environment. Yeah, but our invitation was the same. So I'll say something on academia. How do we position ourselves in academia? Regulatory affairs, research, manufacturing, community pharmacy practice, supply chain, legal issues, and then leadership. And I also want to give a caveat that these are my thoughts. They are not from anywhere else. I was thinking about them and trying to put them down. So out of the experience I've had of over 30 years in service, I'm able to write a few things. I could be wrong, I could be right, but it's for you to try to understand the concept. Next. So again, the changing roles of practice, we have expanded from the traditional dispensing. There are many, many areas we are looking at. And so we need to adapt and demonstrate to other healthcare teams the value of what we are adding. There are changes in technologies. I'm sure those of you who are teachers also, you used to use the Dumas method sometimes, and nowadays you don't hear about it. Yeah. If you go to epidemiology, the changing disease patterns, multi-drug resistant TB, it was not there before, now we are facing it. So, how do we then as pharmacists position ourselves to address these areas? That's what I wanted people to link. That there are so many areas that we can put our expertise into, all the way from academia to dispensing. So having said that, can I end there, Anish? You don't need to show me the card, the minutes remaining. If we understand that, I can leave the stage. But if you want me to talk a little bit more, I can talk. Niendelee kidogo? Okay. The changing technology area. Now we have artificial intelligence. How many have heard about chat GPT? I want to ask those who are the board, the management, evaluations. Dr. Mutie, you are around? Yes. Now, with the coming in of Chat GPT and artificial intelligence, the screening you are doing with medicine, are you going to be relevant? The machine will now be able to do the work. So how are you positioning yourself to that changing environment? Yeah? That's just one area, technology. When it goes to manufacturing, the systems are nowadays so automated that you can bring a machine and put it in this house and it will do everything for you. Take the measurements, withdraw what you call in process, withdraw at a particular time, put somewhere, it is analyzed, gives you the results. So what will be your role as a pharmacist? Those are the questions I needed you to ask yourselves. But again, can we move ahead? I want you to challenge you as pharmacists to look at all the areas I mentioned in the outline. If you are in academia, what are you looking for in the next 20 years? The change of curriculum. Are we producing people who are fit for the job? I think Wairimu raised that issue yesterday. Yeah? Are we fit for purpose? Or we have become alcoholics? We are so frustrated that unaanza kwenda kutafuta pombe. So, what will be your role with all these changes? I know the issue of curriculum we are discussing, and I want to preempt the discussion that may come about curriculum, and my chair and board members are here. We are still encouraging that we engage further. What you have seen is not the end. The board will only pass a curriculum when we've all agreed that it's good for us. So I want to preempt that topic going forward. So other areas I just want to mention, I will not go through anything, all of it, is the legal environment. It's changing. There's the new government, the Kenya Kwanza government, with two major issues in it. One is local manufacturing. Now, we as pharmacists, you did a big farm, you did what? Are you fit to work in the industry? I know Dr. Kimoto is manufacturing in Kemri. IVDs, test methods, and Cecilia with Biovax. Cecilia, are we fit to do what we are doing, or we need to update our skills? So what I'm asking you is that start positioning yourselves by looking at the emerging trends and then adopting to those changing trends, or else you become irrelevant. Yeah. Last but not least, as I finish, because I don't want to be shown a yellow card, is now the legal issues. We have a change in the bill. There is a proposed bill called the KDA. I'm sure all of you maybe are waiting for Machogu, the president, to say as long as Machogu is there, everything is okay. Baba amesoma hiyo, sasa sisi tuko sawa. Si ndio? Ask yourself if it is changed the way it is and it affects how you operate. Is it Machogu who is going to suffer? So we are saying as pharmacists, those of you in leadership and those with a passion in policies, please let's all sit together and contribute and see that whatever legislation comes out is fit for what we want. Let's not wait until it is done and then we start lamenting. I think my daughter Tabitha, With those remarks, I think I've convinced them that we need to reposition ourselves to the changing environment. The slides you can read, I have left the slides for you. You will be given. She's telling me at nichangie KDA bill. Nimeambia mchangie na mchangie pharmacy practitioners bill. Hiyo ni yangu imetosha.
Don't go. No. We haven't appreciated you. All the ladies who are below 35. Si unapenda wale young, eh? Anybody below 35 or you feel you're 35, we want to appreciate
you. You know, Tabitha is my daughter. But she's forgetting she wants to give me young, yet my daughter, my niece are here. Mercy Kapkarich and Roslyn Kapkarich, are you somewhere?